So once again, many friends call me Betty. I met in Taiwan and educated in the United States for master's degree and doctoral degree. I'm now the professor and director of Global Health Program, and I also have another hat, which is Taiwan Regional Director of Asia Pacific Academic Consortium for Public Health. We call it APAC. And if you want to contact with me, here's my email. So just to have a very short brief that actually microorganisms challenge human being for more than several centuries. If you still remember, plague, cholera, yellow fever, HIV/AIDS are all very serious infectious diseases. And from the right-hand side, you can see Spanish flu, Russian flu, Asian flu, Hong Kong flu. And this century is even more challenging. SARS, MERS, Ebola virus, and the new addition, Covid-19, has caused a big problem to the whole world. And as of September 25th, there is already more than 31 million confirmed cases and 1 million deaths worldwide. And this COVID-19 is firstly identified in Wuhan, Hubei, China, last December. More than 200 countries and territories were affected. Many people think Taiwan is very dangerous in the beginning because between China and Taiwan, there's only the Taiwan Strait, and which is only 125 kilometers wide. And of course, we have very busy cross-strait traffic, okay, which is more than 850,000 visits every year to mainland China. And not to mention that there are more than 350,000 Chinese spouses marry and live in Taiwan. There are 400,000 Taiwanese work in China. And the number of mainland Chinese visiting Taiwan is about 2.5 million every year in recent years until 2019. So in the beginning, the end of January 31st, Johns Hopkins Center for Systems Science and Engineering, they predict that Taiwan will have very high risk because of estimated imported case. However, we are doing fine, better than the prediction. Not like Hong Kong, we are more fortunate than them because they have more reported case than the estimated case. So we were ranking number 2, dangerous in the beginning. But now, after 8 months, the situation in Taiwan now is we have 509 confirmed cases and only 7 deaths. No locally acquired cases since the beginning of April. No death cases since May 11th. So I guess that's why I can be here today. It's really a great honor to share with you about Taiwan experience. So here I summarized and also take information from the Ministry of Health and Welfare in Taiwan to show you the 7 key factors and analyze one by one later. Okay, we will start from the SARS experience and the high alert and timely response, then how we do risk communication and information transparency, and how we work with the public and to have proper resource allocation and transmission prevention. Also, the good etiquette of Taiwanese people and advanced medical technology. These 7 are all very important. Let's not forget about the SARS experience. Also, coronavirus also occurred in China in the beginning. SARS affected 30 countries with 8,000 infected, more than 700 deaths. In Taiwan, we have 346 infected, 73 deaths back then. And among them, about 100 cases are health workers, including 11 deaths. And a series of nosocomial infections were found mainly in hospitals that caused 820 million US dollars economic loss. So back in 17 years ago, Taiwan doesn't have cross-agency integration mechanism in the government. And we are still excluded from WHO, lack of international support. And hospital lockdown caused a huge panic among health personnel and the citizens. So just a quick glance of the SARS experience. This is published by Taiwan scholar in international journal. And just to show you the outbreaks of nosocomial infections were found mainly in big hospitals. There are more than 7 of them. And this shocking picture shows that the sudden lockdown of the Haoping Hospital in Taipei. They just basically lock the healthy people and the sick people together without further separation or better isolation. So the health worker here cried out for help from the window. She said, please do better isolation. We don't want to wait and die here. So we cannot forget about this. It's who said. So ever since the SARS outbreak, Taiwan government started a series of reform. It's triggered by SARS. Okay, basically, regulatory review and organizational adjustment has been started since 17 years ago. And we amended Communicable Disease Control Act at least twice, and also established the National Health Command Center, we call it NHCC, which is a cross-agency integration with complete prevention and response system. So Taiwan government can be more powerful to respond to emergencies like SARS or COVID-19. And then follow this foundation, establishment of the COVID-19 Central Epidemic Command Center, we will call it CECC afterwards, was established very soon in January, and then being upgraded from level 3 to level 1, just in about 1 month. And this is the organizational structure of the NHCC and the CECC. And it's actually comprises by a lot of high-ranking officers from different ministries, including economy, transportation, internal affairs, culture, information, etc., etc. Okay, so they are helping with the logistic and operation section. And in here, the structure has a very unique unit. It's called intelligence section, which is led by a group of experts and scholars. They form a advisory group. So this CCC is led by a team of health and medical experts. They make important decisions based on disease prevention and infection expertise. More than 22 expert consultation meetings have been held. Expert team will continuously adjust case definitions and the criteria for case reporting, revises clinical and medical treatment recommendations. This is a chart from the Health Ministry. It's public information, you can find it. But I just want to show you that the expert panel, they continuously update the criteria for reporting and expand testing whenever necessary. And we are very lucky to have political leaders who also are well-trained health and medical experts. Starting from the left-hand side, Dr. Chen Jianren, who is the former vice president of Taiwan, who just finished his 4-year term in May. And he's also a Johns Hopkins graduate and well-known epidemiologist, and was the Minister of Health during the SARS outbreak. The current Vice President of Taiwan is Dr. Lai Ching-de, an MD and Harvard-trained MPH. Dr. Chen Qimai, MD, Master in Preventive Medicine, and he is the former Vice Premier who helped to combat COVID-19 a lot. And this is the picture to show that Premier Su often visit the NHCC and CECC to give for support and supervision. Taiwan President Ya-Wen, she often visits the NHCC as well to get the updates globally and nationally. And just recently, Taiwan president was elected as one of the 100 most influential people in the world by Time magazine. If I may quote, they said, it's hard to find a world leader who's had a better 2020 than Taiwan President Ya-Wen. She won re-election in January in a landslide, oversaw one of the world's best response to the COVID-19 and helmed a economic recovery. And in the beginning, I'm not 100% sure about the statement, but given the recent news that US President Trump has been diagnosed with COVID-19 just yesterday, I believe this description is real and fair. Okay, so when does it start? Okay. Taiwan CDC noticed information from social media indicated that at least 7 atypical pneumonia cases were reported in Wuhan, China on the New Year Eve. It's the last day of 2019. So Taiwan CDC immediately called a press conference and notified the WHO, and also started onboard quarantine of passengers on direct flights from Wuhan. So just to share with you that we are fortunate because we can read Chinese, although it's in simple character, we can understand what it's saying. So multi-language is also very important for public health workers. All right, so it just says that in Wuhan, there is something atypical happened. And Taiwan CDC thought, oh, okay, this is something maybe SARS or very similar to SARS. So we have to start timely response. And this is the photo also shared in some social media, mainly use Chinese, the conversation between whistleblower, Dr. Lee, and his friend. So we know something wrong. And just after a month, we found this paper. Okay, Chinese CDC, they published in the New England Journal of Medicine saying that their conclusion is on the basis of this information, there's evidence that human to human transmission has occurred. Okay. And this paper was published in January 29th. We just hope that if they have the time to write and publish the paper, they should tell the whole world much earlier. So anyway, Taiwan started our own border control in a very early stage. Taiwan banned the entry of Chinese nationals from Hubei since January 26 and extended the ban to all Chinese nationals on February 11th. And also travelers from level 3, the warning countries, are subjected to mandatory home quarantine for 14 days. And you can find our quarantine policy and the definition in the website. So I will just skip this. So we have more stricter border control since March 19. We banned all the foreign nationals. And then on March 24th, banned air travelers from transiting through Taiwan. Okay, so can you see me now? Okay. Hello?
Yes.
Okay.
Hello. Yes, slide.
Okay, thank you. Yeah, because I was blocked by the host.
Please continue, Professor Betty.
Thank you. All right, so let's continue. The Taiwanese people on a charter flight arrive in our national airport. You can see that for the whole journey, they have to fully equipped with PPE. And all the passengers' luggage has to be disinfected inside the airport before they can come out. And we sent personnel to the sea cruise to do quarantine work and health examination whenever it's necessary. And here is the picture to show that Taiwanese people, they learn from the SARS lesson. Okay, they noticed this and started to line up outside the pharmacy, wearing masks to buy more face masks to protect themselves and protect the community. All right, so the CECC hosts daily press conference every day since January 22nd to have better risk communication. And we open the official line and Facebook accounts so to provide it, the most accurate information to the Taiwanese people. The capacity of a communicable disease reporting and the consultation hotline has been increased. And of course, promotional materials and videos in different languages for different groups of people, such as migrant workers and the foreign nationals, are in hand. So this is the picture from our press conference. They even have sign language interpreter to help deaf people to understand better. Okay, and this is the Chief Commander of CCC and also Health Minister of Health and Welfare, Dr. Chen Shizhong. He graduated from Taipei Medical University, my university. He's a very...
we still have 10 minutes for you.
Okay, still have 10 minutes? Thank you. All right. And he's now the most famous politician and minister in Taiwan with highest satisfaction rate, which is more than 90%. And updates and the statistic number of the COVID-19 will be displayed by the CECC every day. This hotline, consultation hotline, is toll-free and work for 24 hours a day, 7 days a week, with at least 4 different languages, including English, and to help people to get the most accurate information. I think you can read this better than me, just to show you that we also prepare different language of advertisement. This is in Indonesian to give people precaution how to do the hospital visit and to show the Indonesian people who live in Taiwan, they know how to properly wear a mask or how to wash their hands in 5 steps. Okay, so we use a lot of advanced information technology to help with the control. The National Health Insurance Database is linked to the database of National Immigration Agency. So our frontline healthcare workers are immediately aware of suspected infections based on travel history and the symptoms. We want to avoid the tragedy like 17 years ago. And the e-referral platform has designated healthcare facilities for testing. Medical system will display a notice when testing has not been completed. And relatively resource allocation. Okay, for example, the name-based mask distribution system has very special programming, and Taiwanese people can use their IC card to purchase the face masks. As of May 24th, more than 20 million people purchased through our contracted pharmacy and convenience stores. And these masks were distributed to 22 local governments for the prevention of personnel in health institutions. Producers and suppliers are coordinated and matched to make sure they have enough productions for the alcohol and the isolation gowns, masks and the thermometers, etc., etc., for cleansing needs and for protection. We also use digital fencing tracking system to do further transmission prevention. So location of people, home isolation or quarantine can be monitored by detecting electromagnetic signals of their mobile phone, which means they cannot escape or avoiding the tracking and avoiding the isolation or the home quarantine. Okay, this is just to show the quick glance of the electronic fencing system. It basically covers the whole Taiwan area. So we also noticed there will be behavior in seeking healthcare change after the SARS outbreak and COVID-19. Mental health is one of them. Okay, we noticed that during this pandemic, our outpatient and inpatient visits to the hospital has both been decreased. Cancer screening decreased, but the anxiety and the mental health visit are increased. So our health promotion administration started to encourage Taiwanese people try to live and towards a new normal. They educate people to stay healthy at home, including eating healthily, do home fitness, use home TV interactive technology platform, use online team-based learning, and provide health education and health promotion activities for elderlies. Okay, and utilize APP for better disease self-management and use remote diagnosis and treatment to help home isolation or quarantine. We are happy to share with you that after 20 years of fighting, we finally passed the Public Health Specialists Act just several months ago. And we believe this is the #1 in Asia. And we want to have more criteria and the proper education and exam for the public health workers and the specialists so they can cope with the emergency and other public health challenges in a better way in future. And we want to give credits to the Taiwanese citizen because most people understand the importance of personal hygiene, including masks, washing hands, and actively cooperate with government policies and measures. Okay. So even now in the MRT, in the public transportation, in subway, in the trains, in the concert, opera house, whenever there's mass gathering, people wear mask automatically and also compulsory. And we're happy to share with you that both the confirmed deaths and the economic decline, the the lowest among the global peers. Taiwan is here. Taiwan is here. Okay. And now, Taiwan government encourage public sectors to cooperate and invest more in the research and the development of medical technology, including rapid test kits, pharmaceutical products, and of course, vaccine. And recently, we signed agreement to join COVAX to have certain amount of coronavirus vaccine alliance from the alliance, hopefully. So once again, I want to wrap up here the 7 key factors. Don't forget the past. Do the regulatory and organizational reform as soon as possible. And strong and healthy leadership would be the critical point. High alert and timely response. Just stick with the old wisdom of border control and the quarantine and the isolation. And do a proper public risk communication and keep information transparency. And of course, resource allocation and transmission prevention, good etiquette of citizen, and in the future, medical technology are also very important. All right, so here comes my conclusion today. Before the effective vaccine come out, we should return to the most fundamental public health core concept. Go back to public health 101. And the importance of public health has received unprecedented attention in this century. So I would like to congratulate Alma Ata Graduate School of Public Health. Again, it was established during such a challenging era with greatest expectations and significance. Just to share with you, I would like to take this special opportunity to thank Rector Haman Hadi for his kindness and long-term friendship with us. Ever since my first visit to his university, he helped us a lot. And then he invited me to join the international conference 2 years ago. And we signed MOU between the 2 universities. He also visited Taiwan at least twice to contribute in our Asia Pacific health promotion, capacity building workshop, and also discuss about global health security in the Asia Pacific region with a lot of experts, both in Taiwan and international.
Okay. Thank you, Professor Betty.
Thank you. Yeah, let the collaboration continue. Terima kasih. Thank you.